the station that's on your side. This is Channel 7 News Good Morning Arkansas.
And welcome back into Good Morning Arkansas. Today we have Dr. Morgan Sauer with Baptist Health joining us to talk a little more about COVID-19 and the flu. We are getting into that winter season. We know the flu typically peaks. And so you mix that with the pandemic and COVID-19, and it has a lot of people very anxious. Dr. Sauer, thanks so much for being here and kind of talking us through this and what we can expect perhaps and what we can do to protect ourselves. First off, remind our viewers how COVID-19 is spread and is it spread differently or the same way as the flu?
It's actually spread in very similar manners to the flu. The first component is how much of this is transmitted through the air. Whenever we breathe out, we have microscopic particles and sometimes larger particles, like when we sneeze, that contain the virus, and they go into the air, and then somebody else breathes them in, and then you wind up becoming infected. Also, you have to be careful because if these particles land on solid objects, say a door handle, or someone coughs onto their hand and touches a door handle, then you touch that door handle and bring your hand to your face, you probably have just contracted flu and maybe COVID.
Interesting. And when you sit down and really think about it, it just emphasizes how important it is to wash our hands, to keep our masks on. Talk about some of the biggest mistakes that we are making in the fight against coronavirus.
So we're all told we need to socially distance by 6 feet. However, if you are not wearing a mask, there is evidence that you can transmit the virus up to 15 feet, especially in a room that's ventilated. So think about that. Masks are typically designed to actually protect people who are infected from spreading it to others. So if you don't have COVID and you're wearing a mask, it gives you a little bit of protection. But everybody needs to wear their mask because the big part is when those masks capture all of that virus that we are exhaling and keep it from being spread. Inside of that, Allison, we are making critical mistakes. And I know that when you and I go to the grocery store, we see this happening all the time. First mistake, wearing a nose outside of the mask. We've known for 2,500 years that the lung and the nose are connected. And so you've got to put that mask up over your nose and over your mouth and under your chin and keep that mask on. That's critical mistake number 2. Whenever I walk into a place of business and someone puts their mask on all of a sudden, you've already contaminated the air all around you since you weren't wearing your mask. You did not do me any good and you're not protecting yourself. So we need to wear our masks all the time. Number 3. Please choose the right type of mask. We've got to have the double cloth masks. One of the things that when we see these gaiters and we see neoprene, those are artificial substances. They're artificially made. And so what happens is when they stretch, the holes in them open wider. And if you're wearing a mask and you open the holes wider, you are expelling more coronavirus and you're bringing more coronavirus in. The 4th mistake is the valves mask. Valved masks don't work. I call them corona cannons because when people have coronavirus and they cough into that mask, it is all expelled out of that valve straight at the person that they're talking to. So valve masks, mask below the nose, just throwing a mask on real fast, and these clear plastic face shields are absolutely useless in my opinion. And when you look at the CDC website generally says the same thing.
Yeah, it's important that we share that with our friends and family members, that these are what the CDC says are good requirements for us when we're wearing a mask. One of the things that I see all the time, you probably see this as well, is people have their mask on, they have the right mask on, they have their nose covered, and then when they go to talk to someone, they pull it down because they don't think that they can hear them.
Oh, yes. That. And then when you're in areas of people and they pull the mask down to start drinking, or they pull the mask down to start eating, or absolutely the worst, in my opinion, they pull down the mask to talk on the phone. You have just contaminated a 15-foot radius all around you with that. Leave the mask on. If you need to do something like that and you're inside, go outside. The weather's beautiful anyway.
Yeah. Good point there. Okay, let's talk about the flu a little bit. How dangerous is the flu this year? Do we know yet?
It's so difficult to tell, and quite frankly, we don't know how bad the flu is going to be this year. one question we have is, since we are all doing this anti-COVID mask protection, trying to do the best we can, will that actually reduce the way the flu is transmitted? And we have all had those years. Some years we have a mild flu season. Some years we have a horrible flu season. Sometimes the vaccines are highly effective and they guess properly. And sometimes we just don't get the right one in the vaccine, so we have a bad flu year. So there's so many influences. But what's most important is right now getting the flu and getting COVID at the same time. That terrifies me on what is going to happen to people who don't have risk factors. With COVID, we hear about people having risk factors like diabetes, obesity, lung disease. I am actually terrified that if you put these two viruses together at the same time in someone who's younger and healthier, you're still going to wind up with a dead patient.
We have to be aware of that, which brings the point of the flu vaccine and who should get it and when we should get it.
All right. Now, some people are going to be upset because they don't like getting shots and they don't like taking the vaccines. But this year, there's just really not going to be any more excuses. People who are under the age of 6 months should not take the virus. So if you have a baby in the first 6 months, that's not appropriate. There are vaccines that are indicated for pregnant women. Some people say, oh, well, I have an egg allergy. Congratulations. There are 2 vaccines this year that aren't egg-based at all. So that is no longer a reason not to get a flu shot. The only reason not to get a flu shot this year is if you have some type of significant allergic reaction, more so than hives, to a component of the vaccine, and not even eggs this year. So everybody should be getting one.
And we should start getting that now, right? It's available.
It is available. I certainly think that you also need to be careful based on your age on what type of vaccine you get. So there are 2 that are recommended for people over age 65. One of them has a lot more of the antigen, which is what causes your body to respond with its immune system. And another one has kind of a super inducer. So you get the antigen and then you get something else that causes the body to really fight hard and give yourself a lot of protection. So seniors need to be sure they choose the right one. Some people who are scared of needles use the nasal sprays. Those can be used on certain ages. They're really not supposed to be used on older people. And additionally, if you are immunocompromised or taking care of someone who's got significant immunocompromised status, you should not take the nasal vaccine. You should take an injectable vaccine.
Okay, and speaking of vaccines, a COVID-19 vaccine has not been approved yet. We know that there are a lot of trials going on. When it is approved, what should we do and how should we manage that?
Wow, that is a very big question. It's pretty much clear that we are not going to have a vaccine before 2021 based on scientific standards and rigorous safety mechanisms. So when the COVID vaccines do come out, it is critical that everybody go get one as fast as possible. Obviously, that's going to be a huge demand, not only in the U.S., but at other places in the world that we're going to have to supply with vaccine to help protect them too. I think, first of all, we're going to need to target our high-risk population. Like I said earlier, the lung disease, the elderly, diabetes, and we're also going to have to immunize other high-risk populations like healthcare workers who are 340% more likely to get COVID as compared to someone who is not a healthcare worker. So when we do that, that's going to be our critical first steps.
And lastly, before we run out of time, you're a practice what you preach kind of doctor. You're actually in a vaccine trial right now.
Yes, I did join the Moderna vaccine trial over at the Baptist Clinical Research Center, and based on a little bit of soreness that I had in my arm, it wasn't bad, nothing more than the regular flu shot, and I'm pretty sure that I actually wound up getting the vaccine. There are no side effects except a little arm soreness, and it's absolutely worth it considering how many people I've seen lose their lives to COVID.
Yeah, you're right there on the front lines. We certainly appreciate all you do, Dr. Sauer. Thanks so much. As always, great information today, and we hope everyone will share this with their friends, especially those mask tips that many of us are failing at. So again, thank you so much. And if anybody has a question, they can always call the Baptist Health Helpline at 1-888-BAPTIST.